Well, our study looked at people with arthritis who were taking paracetamol, and we realised that a lot of people were taking paracetamol osteo, which is a stronger strength of paracetamol. What we did find, however, is that they often didn't realise when they purchased over-the-counter medications that some of those over-the-counter medications also had paracetamol in there. The patients in our study had a diagnosis of arthritis. The majority of them had a diagnosis of osteoarthritis, and a lot of them also had rheumatoid arthritis. So they were the two main groups, the two main patient groups that we had in our study. So with regard to arthritis patients needing to take medication, they adhere strictly to their doctor's instructions, but they also need to make sure before they purchase any over-the-counter medications that they ask the pharmacist or the pharmacy assistants whether or not those medications also have paracetamol in there. Because if they don't, they may be accidentally taking too many paracetamol tablets. One of the biggest problems with taking too many paracetamol tablets in one day is that it can affect your liver. So certainly a couple of tablets may not make a lot of difference, but if you actually take that over a long period of time, it's the problem with the liver toxicity that's a major issue with taking too many paracetamol. The study was driven by a PhD student, Jeanette Ellis, some years ago. Sadly, Jeanette passed away after the data collection had been completed. But all the researchers in the study were from the Wollongong University. There were 254 patients involved in the study, mainly women, and they all had a diagnosis of arthritis. So we were particularly looking at people with arthritis and the types of medications they were taking. I think the outcome from the study mainly is that arthritis patients need to be aware that as well as their Panadol or paracetamol osteo that they're taking, they need to be aware that they need to ask health professionals the active ingredient in different over-the-counter medications in particular. Sometimes they don't realise that cough and cold tablets, for example, have paracetamol in there, so they may be inadvertently taking too many paracetamol.